Hello, I'm Dr. Rohit Lamba, consultant orthopedic surgeon and joint replacement surgeon working at C.K Birla Hospital, Gurgaon. Today, I want to discuss a few things about knee replacement. So, just to bust a few things about knee replacement, because there are a lot of information floating around in the internet, on the newspapers and everywhere, and sometimes people hear some bad things or some flawed things about knee replacement from somewhere. So, just to clear a few myths. First of all, who needs a knee replacement? A knee replacement is only reserved for such individuals, such patients who had severe debilitating arthritis and pain affecting their daily activities. So if you cannot get up from a chair comfortably, you're not able to get into a car or get out of the car, you're not able to go for a walk, or worse still, you're not able to walk inside the house, then yes, that is the time that you do need a knee replacement. Entire knee is replaced or changed. It's just that covering that damaged cartilage surface, which is resurfaced, which is refashioned, and then a new implant is put on it. I will just explain this on this model of the knee replacement. So if you see this, this is how a normal knee implant is. This is the femur bone, the thigh bone, and this is the tibia, the leg bone. So what we do is we just put this, a kind of this implant into the leg bone, which goes in here. Then there's a plastic, highly cross-linked polyethylene in between. And then on top, at the femur, another bone implant just goes like this. And that is what gives you a normal knee implant. So this is how a knee replacement is done. So it's not a complete knee replacement in the sense that only the surface of the knee is changed and the rest of the things, that is the ligaments, the muscle, the kneecap, they all remain the same. So it's not, that's a myth that you change the whole of the knee. So this provides you a good recovery and a good satisfactory outcome. So now, how fast can you expect a recovery after the surgery? Nowadays, what we usually do is, with the pain control measures that we have, the patient is so comfortable after the surgery that we can allow him to stand up and bear weight on those same legs right after the surgery, at the max next day after surgery. So all of our patients, 100% of our patients, stand up and get up and support with support of a walker, and they can move around inside the room and a bit outside the room on the first day after surgery. And in 5 to 7 days after surgery, you're confident enough to handle yourself independently, go to the washroom, go out of the house for a small little walk, and even climb stairs in some cases. So that's how soon you can expect a recovery in terms of walking. And what happens in the medium term? Usually we say that you use a walker or walking frame for walking for around 2 to 3 weeks, and then after that you use a stick for another 2 to 3 weeks. So in effect, around 4 to 6 weeks you need some kind of a support, after which you're pretty much independent to walk without any support. And how soon can you drive after the surgery? Some patients do ask us that as well. So I would say, if it's a car, it's a four-wheeler, maybe 4 to 6 weeks is the time, that is the earliest that you can start driving. But to be on the safe side, you can say around 6 to 8 weeks or so. And return to function, as in how soon can you sit on the floor, how soon can you squat, how soon can you sit with cross leg. Yes, all of that can happen with the new generation of implants that we have, with the new technology. All of that can happen, but it will take around good 2 to 3 months of good exercises and physiotherapy for you to achieve that bending of the knee, so that you can do all of these.